performance enhancing drugs is going to be presented by Luis and myself, Clara.
And the first topic we're going to talk is about what is doping. Doping is the use of substance or technique to illegally improve athletic performance. Doping refers to the use of banned drugs, treatments, and the use by athletes to do a better job on the field. The most two common techniques are pills and injections.
So we'll take you a little bit back into the history of doping. This goes back into the 19th century. There's a first case in 1904 in the Summer Olympics. Dope was first brought out of attention by the Olympic Games by a runner who was injected with steroids, Tom Hicks. Basically, what he was given was a chemical that controls the nerve signals to the muscles and helps with speed and giving him the strength to finish the race. It was actually given by his coach, Charles Lucas. His coach ended up confessing at the 22-mile mark where he finished the race. That's where Hicks collapsed and had to be revived by 4 physicians. Even with the judge knowing, because since his coach had confessed, his medal was not taken away, and it didn't seem that Hicks cared much about it or had regret into it. But regardless, he still didn't get his medal taken away. And then if we go into 1988, the world became accurately aware of the extent and benefits of doping when Ben Johnson's gold medal was stripped in the 1988 for using steroid. That is when the International Olympic Committee Medical established a list of prohibited substances in 1967 and introduced anti-doping tests of athletes in the 1971 Munich Games.
Yeah, there's another cases like Marion Jones in track and field, Lance Armstrong in cycling, and the more recently is the Major League Baseball with the case of Barry Bonds and Mark McGwire. And now the Major League Baseball have a very huge and very efficient doping system. Now, this topic is about the blood doping. What it do is increase the red blood cells. That means that you have more oxygen to do a better performance. Also improve endurance. That means you can have more strength to build more muscles. And blood withdrawn and refused, that's called the EPO. Basically, they take your blood from your body, they freeze it, and then after 24 hours, they can put it back in your body. It's like a fresh blood they put in your body. And the risks are basically you have problem with the liver, your heart, your kidney, or pretty much all the internal organs of your body.
Yeah, so usually what happens is that since our body is so sensitive to these changes, the blood thickens and your heart ends up working double or even triple more in order for that blood to pump blood throughout the body, and that's what increases all those risks, such as like the heart attack, stroke, and everything that Luis just mentioned. So then we go into steroids. What are steroids? So steroids are also known as anabolic steroids. They're synthetic versions of testosterone. It increases muscle mass and strength. Some athletes take a form of steroids, and this helps them boosts their athletic performance. With this, it does have some effects to your body. So with those effects, it has, go back faster. Sorry about that. So it promotes muscle building, which a lot of athletes, their goal is to have more muscle and less fat. So they find the easy way out. Majority of them find the easy way out by taking this, so that way it can help them with their muscle building. The only thing is that there are some risks, such as facial hair, and it also gives them a deeper voice.
In the case of the males, it says synthetic testosterone. That means that your natural body produce testosterone. When you put something synthetic in your body, that means your original ones doesn't develop in the future, doesn't develop more, and that's they have more problem like testicle and all kind of problems in your organs that really struggle in the future. Let's see, next one. Okay, that one, the different types of steroids. The androstenedione or andro. That ones that pretty much help you to do a better performance. The human growth hormones or HGH, that's most of the recent ones. That's the hormone they take for the brain of the dead people. Usually when you go to the morgue, they use that kind of hormone for the morgue. And the diuretics like Winstrol that's pretty much used to lose weight. The third one, erythropoietin, I can pronounce that one. And that's a mix. You can mix this one for the andro to basically is to the people that like the bodybuilders, they usually they increase muscle mass and they don't want to shred the muscle to have more definition. But it's a complete cycle. It's a complete different story how to do it.
So with all these different types of steroids, there comes many risks, but most of that have in common with all of those are for men, they develop, prominent breasts, their testicles shrinking, can decrease infertility and prostate gland enlargement. Such as with women, it gives them a deeper voice, which may be irreversible. It also enlarges their clitoris, which may be irreversible as well. And they also get more body hair, baldness as well, which that's something that, possibly they can't come back from. And basically with the rest, they don't have the menstrual cycles, so they're probably irregular or just don't have a cycle. Something that both men and women experience is acne, also liver abnormalities and tumors. They increased tinnitus and tendon rupture. And then it also increased low density lipoprotein and cholesterol, basically the bad cholesterol. Something that I didn't know until my own personal experience is that there's two different types of cholesterol. There's a healthy cholesterol and there's a bad cholesterol. So this ends up, increasing the bad cholesterol.
Yeah, basically all these steroids and in a long term, they're gonna have affect you in different ways. You can see a lot of people like professional wrestler or bodybuilders. A lot of them they die very young, no more 50 years old, pretty much. Because why? Because all the side effects of the risk that they have until they start using estrogen for a long period of time.
And then with these risks, I also have there's this influencer that my partner follows on YouTube, and he ended up having a heart attack just because he started taking too much steroids, basically. And it also, he did mention all of these risks, that happen, and some of these are just irreversible. I wish I can remember his name, but since I don't really pay attention to what he watches, I just go based off when I'm there. But I know, just I've seen people go through this experience,
Yeah, but it's not only professional athlete. You can see artists from Hollywood or models, they do it that way. It's a peer pressure.
Yeah.
Okay. Other at-risk population for doping. In this article, that pretty much said the 2 steroid groups. This article from 1988, and they said that a student from high school, from 60 years old or younger, they say 38% use injectable steroids. This is a lot. really. It's something that concern a lot because all these kids, they want to, for example, they want a scholarship to go to college to play football, baseball, or basketball, and have the pressure to do better to have the scholarship. Or some of them, they do it because they want to look good. The same with the girls not behind on this. They want to do gymnastics, swimming, or softball, whatever, and they want to, it's only for have a scholarship. And now, it does that happen with the professional athlete when they want looking for a big contract, big money. They do whatever they want. It's like a shortcut, and also to have this huge contract they have on professional sports.
Yeah, and then another thing that I've noticed too is just because when I go to the gym, I've seen people, that look good, they do look bigger and everything. But, at the time, of course, with me not knowing them, but then, for me going frequently to the gym, I came to know them. And then one did confess to me that, he does use steroids and injects. And his personal reason is more because of the fact that, he works so hard to get to where he's at, and then now that he has kids, he has to back out with a gym and stuff like that, but he is always self-conscious on making sure that he doesn't lose what he's worked for, which is understandable, but at the same time, it's kind of difficult with that. It does take a toll on mental health as well, when it comes to steroids.
Mm-hmm.
And so it's just something that not a lot of people take into consideration as well. And, they just think of the moment, which is completely fine, but,
most of them, they think on the moment, not in the future, when they start using this. And then later take the consequence.
And it sucks because most of the time, families are affected of this, or even, they might feel good for 5 minutes type of situation, but then be hurt for many years type of thing. So it's something, that is peer pressure as well. And I wish that some people would think about it more, but I understand also, like, some people just want to live in the moment.
Okay, next one.
So in conclusion, modern sports and the media misplaced fixation on fame, fortune, and winning at all costs have an unintentionally created growing market for doping substances. These are once only abused by elite athletes and are spreading into schools and health clubs, just like, the experience I just mentioned. They are being a little bit more open-minded with it and accepting into new generation of young customers who see reports daily in the newspaper, a sports icon accused of abusing drugs, only to continue to play, breaking records, claiming fortunes. These same performance-enhancing drugs are also abused by adolescents and weakened athletes and non-athletes who have greater behavioral and health risk problems. In addition, these drugs are now being abused by male and female for cosmetic purposes in order to achieve the cut and sexy look promoted by the media. I know that I follow a lot of influencers on Instagram, and sometimes based on how they look, I can't help myself to think if it's really all natural or if it's, if they're using. Some have been pretty clean about it that they do use it, obviously because they just want to look good, like how we've mentioned this whole presentation. Medical professionals, teachers, coaches, and sports organizations must all be made aware of this continuing problem, just because not a lot of people, like we mentioned before, don't think about it in the long run. They just think about it in the moment. So this is something that should be talked a little bit more and have an open and honest discussion. Most importantly, professionals, athletes must serve as role models and spokesmen for drug-free sports and lifestyle. I understand that this can be a little bit difficult just based on, their lifestyle as it is right now. So it's just something that, professional athletes should serve as role models. This position may be actively supported by the media, owners of teams, international sports federations by providing consistent leadership and advocate of anti-doping programs, regardless of the cost and consequences.
Yeah, and this conclusion is very, very good. But in my opinion, I am certified as a personal trainer. And when I was working back in Puerto Rico, I did it for 8 years, and really I saw a lot of things inside the gym. Is dealing with steroids is basically people that offer you the vials for free, like a regular drugs for free. Use it a couple of times, check it out, and then the next one you're gonna see the change very very fast, and you can see a lot of movement inside the gym. That really, in my opinion, don't use it. If you start at 20, working out at 20, 21 years old, use it like a lifestyle. You know, it's like a marathon for the rest of your life, for 30, 40 years. Not try to do shortcuts to look good and big and better in 1 year and then start using that. It's like estrogen is an addiction, really. When you start using it, it's very difficult to stop, because at the moment you're gonna see yourself very, really big, lot of muscles, but at the end you're gonna pay the price. And really, it's my opinion. Don't do it. Don't do it, because the consequences are very bad, and it's very expensive. It's very expensive to have that kind of drugs.
Yeah, and then like you mentioned, it's really addicting. It can become really addictive, and it really can hurt a lot of people down in the long run. And then something that I always tell people to think about is, I know we all have children here. Most of us have, and it's something that we think about. Is just like making sure that we're around for our children, to see them grow, see their accomplishments, things like that. And I understand that some people don't have children yet and are doing this. But if eventually at one point in life you do want to have children, I mean, to me, that's just my own personal opinion about it as well. It's just think about your future for sure, especially if you're having kids, just because, in a way they get affected by this as well.
Yeah, I remember I reject a lot of customers. They want the magical pill, the shortcut way, easy way to do it. I say, no, it's not that way. Not with me. I can make you a fitness program, but really, don't look at me like the mule, the looking for the drug. Really.
Yeah.
I see a lot of this stuff in the gym before. Really, I don't want to deal with this. That's the reason when I moved here to Florida, I just say, no, it's not for me.
Yeah.
Now I do it for myself. The knowledge that I have is for myself. That's it.
Yeah, and that's what I was saying. I know, like in a lot of bigger cities, with you living in Florida, you probably see a lot more over there than what I have here in Nebraska. But I know usually, like with bigger places, especially when there's more opportunities, especially with weightlifters, bodybuilders, things like that, they just look for the easy way out. And again, it's something that, you really shouldn't do, just because there are consequences in the future.
Yeah, it's easy to recognize. Yeah, I really, I can see from far away. Okay, it's natural. He's not. That's pretty much, that, because I know how this works.
Yeah.
Okay.
So in this slide just includes some of the references that we used. We did use a lot more, but just due to the amount that we used, we just decided to select a few and present our references. And thank you so much for watching.
Thank you very much.